This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what happens if you don't get treated for a broken ankle. If you like this video, we put out new content weekly, so please like and subscribe. So the ankle joint is called the ankle mortise, which just means it's a funny shaped joint that kind of looks like this, where your top foot bone called your talus sits here, and you have the inside and outside ankle bones that sit like that. So when you break your ankle, the goal is to keep this shape intact. So sometimes if you break your ankle and you break it on the outside, the bones don't move too much, and a lot of people can do okay with walking on it in a boot until the bone heals, as long as this mortise shape is not interrupted. Now, how do you tell if it's interrupted or not? You have to get x-rays. That's the only way you can tell. And a lot of people, when they go to the ER, they go to an urgent care, they'll get x-rays with you lying down, meaning that you're not weight bearing on the ankle joint. Now, those are okay, but those aren't good enough. So to truly tell whether that ankle mortise is disrupted, and this is the difference between getting surgery and not getting surgery, you need to get weight-bearing x-rays of your ankles. There's also other sorts of x-rays like stress ankle x-rays or gravity ankle x-rays, but I like weight-bearing x-rays. So I've seen it before where someone has an ankle fracture and it looks stable on the normal x-ray, but as soon as you have them stand on and take x-rays with their stand in, it opens up. So that's a problem. If the ankle mortise is disrupted at all, meaning that the ankle opens up, and this can happen if you break your ankle on the outside and on the inside or just on the outside, but if that happens, then you need surgery to fix it. What will happen if you don't get surgery to fix it is that it'll heal, but it'll heal wrong, and then this shape will be disrupted, and even a few millimeters off, you'll basically have chronic ankle pain for probably the rest of your life. So, and if you do have a fracture of your ankle and the ankle joint is disrupted, you really don't want to wait too long to get it fixed. You have about 2 weeks or so. After about 2 weeks, the bones start healing together, and it can become very difficult to fix it properly. I mean, you're talking moving the bones a millimeter. So it's not as easy as re-breaking it and fixing it again. A lot of times, you try to move it, it might break off into pieces, and it doesn't quite work out that well. While if you get it fixed within the first week or two, especially the sooner the better, the bones just move right back where they're supposed to be. And it makes it easier to fix. So what will happen if you don't get treated for a broken ankle? If it's a stable ankle fracture and it's just on the outside of the bone, then I can't advocate not going to a doctor, but you'll probably those can be treated successfully in a splint, and you can actually walk on them in a lot of cases. If you have it where you break both sides of the ankle or your ankle joint's disrupted, you'll do very poorly unless you have surgery. So it's my opinion that you not wait to get that. So I hope I was able to answer your questions about what happens if you don't get a broken ankle treated. If you have any questions I didn't answer, feel free to leave them in the comments below, but I can't give you medical advice about your specific condition. Again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.